everybody. This is Jessica Shavi. I'm going to be doing the catheter, the catheter and the Foley video. I'm going to go ahead and tell you which supplies that I have first. So I have my patient here. I have my trash bag on her left hip. I have soap and water, along with 3 clean washcloths, clean gloves, and then a package for the Foley and the catheter. So I'm going to go ahead and get started. I will take off my badge once I'm done introducing myself and once I get started with the cleaning. Hi, Ms. Jones. It's Jessica, your nurse. Can you please tell me your name and date of birth? So as she tells me her name and date of birth, I'm going to go ahead and close the door and close the curtain. Great. So I'm going to go ahead and put a Foley in you. Are you comfortable with that? Are you okay with that? Okay, awesome. So I'm going to check your wristband real quick. Everything looks good. So while I'm washing my hands, I'm going to go ahead and ask you, do you have any questions about the procedure that I'm going to do or anything like that? Okay, and just know that I will talk with you along the way. I'm not going to do something just randomly and then it makes you flinch or anything like that. I'm going to just make sure I tell you every step of the way, okay? Okay. So first thing I'm going to do is I'm going to lie you all the way back because it's easier for me to access it. So I lie her all the way back. And next I'm going to have you bend your knees all the way up. Great. And then go ahead and do a butterfly with them. Perfect. I'm going to go ahead and take your blankets off. And then I'm going to take another blanket for privacy and put it right there. So I'm going to go ahead and start by putting some clean gloves on. And before I put these clean gloves on, I did make sure that she was at a comfortable height so I'm able to see her well and it doesn't hurt my back. So, Ms. Jones, the first thing that I'm going to do is wash you, okay? So, I'm going to put some soap and water in here and I am going to touch I'm going to open your labia, okay? Okay. Now I'm going to do top to bottom on the farther side away from me. Put that in the laundry. Top to bottom on the farthest side away from me, or the closest side to me. And then different part of the washcloth, and I'm going to do right straight down in the middle, top to bottom. And put that in the laundry. Next, Miss Jones, I'm going to go ahead and pat you dry, okay? Great. Now I'm just going to take a look so that way I know where I'm looking, and I'm going to go ahead and inspect for anything, okay? Okay, now everything's good to go. I'm going to go ahead and take off my gloves, throw them in the trash, and then I'm going to move some things around here so I can get ready. I'm also going to take my badge so that way it doesn't affect the sterilization. Let's see if I can turn Miss Jones for you a little bit more so you can see her better. Next, I'm going to wash my hands again before I get started. And after all that, we're going to pull this bag out. Starting with flipping this away from me, and then to the side and side, and lastly towards me. And because I have this 1 inch around here, I'm going to go ahead and just move this just a little bit. Grab my sterile gloves. And then I'm going to go ahead and put my sterile gloves on. Using my 2 fingers, just pinching the cuff and pulling in. Then using a few fingers here, cuffing it, and putting my dominant hand in. Then I'm going to pinch this and throw it away. Next, I'm going to go ahead and take this blue curtain. Okay, Miss Jones, now I'm going to put this blue curtain under your hip, okay? So if you can lift your hip super high for me, awesome, you did great. Go ahead and bring it down. And then I'm going to take this white sheet, and we're going to do the same thing here. I already did a video on this, so this is ripped from a previous video. So I just need to make sure that that's good to go. Okay, that white curtain is simply just because I want to make sure that we don't break sterile while we do this, okay? So next I'm going to make sure I get everything set up. I'm ready to go. I'm going to take this lubricant, I'm going to open it up, then I'm going to put some in there. Then I'm going to open up my alcohol swabs and set those there ready to go. And then next I'm going to take my catheter and coil it. Just like that. And dip it in the lubricant and just have it there ready to go. I'm going to kind of coil it a little bit differently here so that way, there we go. Next I'm going to take this and I'm going to pop the cap off. So my syringe, the tip is completely broken off. I don't know if you guys could see that. It's completely broken off, but I'm going to continue everything like it's good to go, but it will drip water. That's what this is from I was practicing before. But I would have stuck this in here, so I'm going to pretend like it's in there. It just, because of the pressure and stuff, it pops it. Oh, maybe not. Sometimes it pops it right off, so if it pops right off, I'm going to still pretend like I'm going and everything's good to go. Okay, Miss Jones, so now I'm going to clean your inside of your labia and stuff like that with the alcohol swabs, okay? So with my left hand, I'm going to go ahead and touch the top of your labia, okay, and open you up. All right, now you're going to feel some cold. I'm going to go top to bottom just like with the washcloths that we did earlier a second ago. I'm going to do the same thing, top to bottom. It's going to feel a little cold, okay? Here we go. Top to bottom on the furthest side away from me. And then top to bottom on the closest side from me. And then new one top to bottom in the inside. Now my left hand is no longer sterile, so I'm going to keep going by using this left hand as my opener. So by holding 3 to 2 inches, I'm going to take the Foley catheter. Okay, Miss Jones, I'm going to stick the catheter in now, okay? It's going to feel a little wet. I want you to take some deep breaths in when I say go, okay? Take a long deep breath in. Ready? 1, 2, 3, go. You're doing a really good job. We're almost there. Now I start to see urine. That's when I'm going to only do about 2 inches more. Very good. Then I'm going to take my syringe and blow it up. It's spilling water now, but I would use the whole 10 milliliters and then I would take it off right away so that way the water doesn't come back into it. And then I would do a stat lock onto her leg. Does that feel comfortable, Miss Jones? Okay, good. I have the stat lock in so that way nothing can pull, okay? All right, does everything feel comfortable? Nothing feels uncomfortable? Okay. So then I'm going to take this bag, I'm going to hang it on the side of the bed. I'm not going to hang it on a railing because that is a movable object. I'm going to make sure it's an unmovable object that you're hanging it to. So I'm going to hang this on the side. I'm going to clamp this to a sheet so that way it's further protection that it doesn't fall out. So as everything's hung, I'm going to go ahead and start cleaning up. So with this, the reason why I have this right here is because I don't want to rip too many sides just in case I have to do it again, but I rip this and pull away to throw that away. And then I would start to clean up all of my mess. I'm no longer sterile with my hands, so it's okay to go ahead and just touch everything now. Now, Miss Jones, I'm going to bring your bed all the way down now so that way it's a safety for you. Great job. And then, are you comfortable the way you are, or you want your head up a little bit? Head up. I'm going to bring her head up a little bit. I'm going to cover her back up. I have the bag hanging there. So now what I'm going to do is I'm going to wash my hands. I'm going to go ahead and chart everything that I've done now that I have everything cleaned up. I'm going to chart everything that I did, how well she did, and if there was any urine out, a lot to be able to measure, I'm going to go ahead and measure that. I'm going to say, okay, Miss Jones, if anything feels any different, I want you to let me know, okay? All right, I'll come check on you in a little bit. I'm going to go ahead and leave while closing the door behind me.